doxycycline or medications like that, it's very difficult, isn't it, to get enough to handle issues for an entire survival community. So what are the choices that you have? Well, there are actually some options. Now, we raise tilapia as fish food in a pond down in South Florida. And those fish sometimes, develop infections or get sick, and so we have to treat them. And so for many years, I have had supplies of these things. And these are aquarium antibiotics, or veterinary antibiotics specifically for fish. But when we started getting involved in the preparedness movement, we sort of took a look at this and said, what are our options? People just can't get a prescription for 1,000 antibiotic pills or enough to handle problems in their community. So what can you actually do? I looked at these and I saw that the only ingredient in every single one of these things is the antibiotic. There's nothing here that makes your scales shiny, nothing here that makes your fins longer. So these are all just the antibiotic. Interestingly enough, they're not only just the antibiotic, they're in exactly the same either human, pediatric, or adult dosage that you would take for human medical problems. This is ampicillin, 250 milligrams. And fishcillin forte, which is a strong version, is 500 milligrams. That's the adult dosage. Fish mox, 250 milligrams, normal of amoxicillin, normal pediatric dosage. Bird biotic, that is doxycycline, 100 milligrams, normal adult dosage. All of these are the normal adult dosages. And I want to ask you a question. Why does a guppy need an 180-pound human adult dosage of an antibiotic to get cured from an infection? And I'll tell you why I think it is because they come from the exact same batches. They're available in quantity. You do not need a medical license to obtain these. If you would like to buy 5,000 amoxicillin tablets, you can order it online. All you have to do is, by the way, just Google any of these names online. You'll find a number of different places that sell them. And they're inexpensive. Unless you have one of those $5 prescription plans, then you probably can get it for cheap. But ask your doctor for 100 of these and see what he says.
What about long-term storage of antibiotics?
Oh, okay. Actually, I had a slide on that, but I'm going to tell you about long-term storage of antibiotics. Only get these antibiotics in pill or capsule form. Store them at preferably 50. Store them at 50. Yeah, I know. Yeah, I know. That's why I need constant supervision. Hold it still. This is my left hand. Okay. All right. Store these pills and capsules, only pills and capsules, in a dark place, a cool place, 50 degrees preferably, and a dry place. If you do that, they will remain good for many years. And here we go again. This is why I'm Dr. Bones. Disclaimer. I didn't use my actual name for many years because I'm going to be. I was saying, oh, what did I do wrong now? Is because I'm telling you that these are going to remain good for many years if you store them the way I tell you, beyond the expiration date. Not only that, but I have proof of this in that their government actually had a program called the Shelf Life Extension Program, in which they had all of these FEMA medications that they had stockpiled that went, guess what, expired. And so they said, what are we going to do with these millions and millions of doses of all these various antibiotics and antivirals and things like that? And so they tested them. And guess what? They found that these medications still retained 100% of their potency 2 to 10 years after the expiration date. And I suspect that the ones that were 2 years was because they were only expired 2 years at the time of the study. So therefore, that is my advice to you. It is against conventional wisdom, medical wisdom, to tell you to do this, but indeed, that is what the truth is. And so, stockpile these. You can get them without a prescription. They'll last for years. There's no medical license involved. They will handle many different medical problems. In my book, we talk about how to use antibiotics, and my blog has a number of articles on the subject. And these are meant for a collapse situation. I'm not telling you to be your own doctor. Guess what? It's illegal to practice medicine or dentistry without a license. So I'm talking about when there is no hospital, when there is no doctor, this is your option. And it is a good option, and have no doubt it will save a life one day.